So we talked about implants and lumpectomy reconstruction, and then again, reconstruction using your own tissues. Traditionally, you would use skin and fat that's attached to the muscle, kind of like in the picture on the left where you see the back muscle. It's latissimus, and then you see the muscle, and then there is skin and fatty tissue from the back that's used to replace the breast, or the same was used from the abdomen. One of the drawbacks is that you take the muscle, right? And muscles are functional. So whenever you take muscle from one part, there may be some deficit or weakness, like in operation on the left that can affect arm movement, and the surgery on the right where you take one of your abs or rectus muscles that can affect your core strength and cause weakness of the abdomen. So then the invention of microsurgery, where rather than take the muscle, we're able to transplant the tissue, which is skin and fat, from different parts of the body on its blood supply, then connect it to the blood vessels in the chest, an artery and vein, to reestablish the blood flow. And that way you get living tissue it's your own living tissue that's transplanted from where, like you said, where you have extra tissue, like your lower belly, or let's say it can be your inner thighs. Again, all with principles of cosmetic surgery where the scars are well hidden. If it's the belly, it's like a tummy tuck incision. If it's in the inner thigh tissue we take, it's more of a thigh lift incision, but it still allows us to take this tissue, skin and fat, which is very similar to breast, which feels like fat too, and then using either microscope or special magnifying loops, we connect these 2 millimeter blood vessels, and that way we transplant the tissue and you get reconstruction with your own tissue. So that's called free flap breast reconstruction, versus muscle flap that I mentioned earlier, that traditionally you didn't do the microsurgery, you just kind of rely on the blood supply that goes through the muscle and then to skin and fat.